Depends on your area. We use about 5 different labs. What we'll do is once we figure out, okay, here's the NPI, here's the area and the demographic, then we will contract with about 5 different labs for your location. And inside of that, like Cigna will go to one lab, UHC will take a different lab, Medicare, Medicaid might take a different lab. We use larger labs. We don't use little labs because we don't want the patient we want everything to be in network, and we don't want the patients to get a bill. And so we're using larger network labs to make sure that patient doesn't get stuck. We do ask, so the responsibilities, we do ask that you name us as an additionally insured for the technician that's doing the service at your site, because they are going to be handling biologics. We do ask that we sign a mutual HIPAA agreement. We ask that, if you decide, hey, we don't want to do this, that we get a return of our equipment. We ask that you work with us to develop standing orders, and those are unique to each physician. So in 41 practices, I have 60 sets of standing orders. That technician at each side learns those standing orders and follows them and then goes to the physician.